Hi, Dr. Travis Rose here from Peak Form Health Center, and today we're going to go over a gait analysis of a triathlete patient of ours who has been dealing with nagging knee pain, and he has been having this knee pain after pretty much every single run that he has been doing. He's been having the pain in the front part of his knee, so we are going to take him through our running analysis that we do in the office here to see what we can find and evaluate that running form to try to get him running more efficiently and pain-free.
Okay, so we're going to look at our triathlete who's coming in with some knee pain, and he said he's been having the knee pain after every single run for several months now, and this is his first season competing as a triathlete. So we want to get him on the treadmill, do the running analysis, and see how we might be able to adjust some of his running technique to take some of the pressure off of his knee. And I also chose not to ask him which knee was bothering him for the initial assessment here, just to try to have an unbiased look at his running form, see if we identify which side might be having a little more difficulty than the other. So first, just want to take a look at the running stride in general. And he's a tall guy. He has a pretty wide stride, a little bit of up and down bounce to his running gait. And overall, I mean, he's fit. He looks like he has decent running form, but there's a few things right off the bat here that we can take a look at to try to improve his running efficiency. So when we slow it down, and I'll just take it back towards the beginning here, that his right leg's coming through, and there's initial contact. So one of the first things we want to look at is where is the foot landing in respect to the rest of the body. So ideally, we want to see the foot come in contact right underneath the knee here, as close to the torso as possible, and creating a 90-degree angle between the knee, ankle, and the ground. So you can see that he is a little more open at that angle, which results in more of a braking force that his body has to overcome to maintain his momentum. So his muscles, his joints are going to have to absorb more force than necessary to maintain his running pace. So that's one indicator there that we can work on to try to improve his foot strike and get that foot closer to his center of gravity to allow his body to absorb shock more efficiently and a little easier. So that's the right leg. Now let's look at the other side. We want to see what the other side is doing as well. And right there, we're getting some initial contact. And when you compare the two sides, this left leg appears to be overextending even further than the right side. So he's going to get even greater force going up his body that he's going to have to deal with, or that his body's going to have to dissipate. So after we looked at the video here, I just asked him, hey, is it your left knee that's bothering you? And he said yes. So that is a pretty good sign that we're on the right path into how to help with his knee pain. So one of the things that we're going to be working on is getting that foot strike a little bit closer to his body. And the other thing that we looked at initially here was we just want to look to see what his overall cadence was while running. So when we look at the running form here, he has a relatively slow cadence. So what we shoot for is about 170 to 190 steps per minute. And that's regardless of what pace you're running at. Your body should be able to get into that cadence relatively easily for running efficiency, or increasing running efficiency. So when we did the measurement, was actually around 150 to 154. So he's relatively low for cadence. So the first thing that we're going to try with him is actually seeing how his body adjusts to running at a quicker cadence or a faster cadence.
So cadence is a really important aspect of running form and running technique. A lot of runners, especially new runners, or we see a lot in triathletes, that they run with a very slow cadence, and what that will do is allows the foot to come forward in front of the body, and then that creates an excessive braking force that then your body has to overcome every single step. So when you're doing long runs, we're looking at thousands and thousands of steps that your body has to overcome and absorb more force than necessary. So getting the cadence higher to a range of about 170 to 190 for majority of your runs, that's going to get the foot closer to your center of gravity. It's going to put your joints in a better position to actually absorb the force more effectively, and it maintains your momentum going forward.
So during the initial assessment, we also look at the backside to see what his legs are doing as well during the running gait. Now we already know from the side view that he is overextending both legs, a little worse on the left side, and that he's running with a fairly slow cadence. So just to quickly go through this back view here and running at normal speed, watching him run, he still has that, up and down vertical bouncing to his stride. That's something that we do want to address at some point to try to minimize. But the other thing that we want to look at from this view especially is where are his legs landing in terms of each other. So what we want to really dial in is where the legs are landing in relation to that stance leg. So slowing down here, you can kind of see that he has this wobbling side-to-side motion with his body while he's running. So when you slow it down and you look at where the legs are, or where the feet are landing, so we have the right foot coming down and he's right there with his stance leg here, and we'll just kind of cut it in half just to kind of get an idea of where the right foot landed. And now we're going to bring the left leg through and see where it lands. And you can see that his foot is basically landing almost in the same spot as the right leg, so he's running really narrow with his stride. So just to demonstrate that a little bit further, we'll just do a new circle, draw a line pretty much towards the center of the foot there, and then let's bring this right foot through now, and this one, same thing. And this one especially, not only was it landing in the same spot, but actually looked like it went further than that spot where the left foot was. So this is very indicative of a gait called crossover gait or tightrope walking gait. And this can put a lot of strain into the various tissues of the lower leg and the body. So this can definitely cause aggravation of knee complaints because the knee is having to bend and function at a more aggressive angle than it normally would. So for looking at the lower extremity here from this angle, we want to see the foot a little bit more underneath the hip. There is going to be some inclination towards that midline naturally, but we don't want to see any excessive angulation or this tightrope crossover gait that he is demonstrating here, where it's just so excessive that it's going in front of the previous stance foot. Okay, so this is definitely something that we want to work on so we can decrease the load at his knees, and particularly that left knee where he's having the symptoms.
Running with a crossover gait is a very problematic gait that can exacerbate a lot of injuries, overuse injuries, just nagging injuries that are recurring. And that's one of the big components that I ask a runner that, have you been dealing with this injury for a long time, or is this something that keeps repeating for you when you're in training? And a lot of the times patients will say, yeah, when I get to mile 20 during the week or mile 30 during the week, that's when I really feel my shin splints kicking in, or I really feel that IT band syndrome kicking in. That is a clue to me that they need to do a gait analysis so we can look and see what the legs are doing. That what's happening during those weeks is that with a crossover gait, they're accumulating this stress through the muscles and the tendons and the joints throughout that whole week, and then it reaches a certain point in their volume where their muscles have had enough, that they start feeling sore, they start feeling strained or overworked. So by reducing the crossover gait, their body's going to function in a more stacked position. They're going to be able to absorb forces much more naturally and easier in the correct position for the muscles and the joints. So it will decrease the load on the shin area. So posterior shin splints or posterior tibialis tendinopathy is a big one that we see. Also IT band, hip bursitis, hip pain, hip discomfort, and also lower back pain. So getting the crossover gait go away, diminish, widen the stance a little bit, it's going to create a better platform for the joints and the muscles to work.
Okay, so now we're going to look at a comparison video here. We did several rounds of working with the patient and increasing his cadence. We were doing about 5 steps per minute more each round to get him to 180 steps per minute, and that's going to be demonstrated on this right video here. On the left video, that's the initial run, and just as a reminder, he was running at about 151, 154 steps per minute. So it's a pretty drastic change that we did with him in this video on the right here in comparison to that initial run. So what we want to look at from the side view is, again, where his foot's landing in relation to his body. And just on this initial run, you can see that he's got real wide open stance coming in very far out in front of his torso. And when we look at the 180 steps here, so let's get to that left leg for equal comparison. So just looking at his stride in general, it's shortened up a bit, and that he's landing, or he will be landing here much closer towards his center of gravity, as opposed to over here he has a really wide stride, coming in way out in front in comparison to his center of gravity. So overall, looks like it's been a beneficial change just from the start here. So now let's clear that, and then looking a little bit more specifically at his foot landing. So right there is when he's getting initial contact and starting weight bearing, and on this side about there, initial contact, getting some weight bearing. So he's still coming in with a bit of an open angle here at the initial foot strike, but in comparison, it is a bit subtle, but it is much improved compared to the initial run. And the other big aspect of it is that I already mentioned, that the foot is coming in much closer towards his torso, so his body's only having to deal with the vertical loading that is experienced during running, and he's dealing with less reaction force than the first run that he did, where he was way out in front and really absorbing that reaction force. Okay, so overall, looks like a beneficial change so far. And now we want to look at the other view to see how the increased cadence improved that crossover gait that we mentioned before.
Okay, so in the last view here, we just want to look at how cadence affected his crossover gait that he demonstrated in the initial run. So the initial run is going to be on the left here, and then the cadence change with about 180 steps per minute is on the right. So let's go ahead and just hit play in slow motion here. And looking at the left, you can see that he's running real wobbly, really narrow. His legs are crossing right in front of each other, and sometimes even across midline. So when we look at the cadence on the right side, or the form on the right side, with the increased cadence, he's running a little bit wider. He's not deviating as much towards midline, so there is a little bit of space in between each stance leg, which is what we want to see. So with that, looking at the different stance legs here, that on the initial run that he has that increased angle going in towards midline or even across midline, and then in the increased cadence, there's still a little bit of an angle, but it's not as drastic as it was before. So overall, it looks like increased cadence is a beneficial change for him. So that's going to be the initial point of care for him to get past his running knee injury. And the other thing with the knee is that running with a more stacked position like this on the right side, that his knee is going to just bend forward and backward really easily, versus when you run with the crossover gait, it strains the knee more because now there's more angulation at that knee joint. So this will definitely help him with that knee pain.
So after just working on cadence with this particular patient, he went out for a 10-mile run after doing the analysis, and he got his cadence up to, I believe he said mid 160s or so. So it's still relatively low to the range that we want it to be at ultimately, but he didn't have any knee pain after a 10-mile run. So that is a huge improvement after just doing a single gait analysis and him being able to apply that to his very next run. And since then, I've checked in with him periodically, and he has yet to experience any knee pain on that left knee. So overall, very successful with just one gait analysis, and I just encourage him to keep practicing it and keep trying the different cadences to see where he finds a comfortable range to fall into for his normal day-to-day runs. And then after about a month or so, I'll have him come back in. We're going to look at the treadmill and see what else we can work on to help further improve his efficiency and also increase his performance.